Thank you, Madam Speaker. I'm rising today to respond to this budget, but I want to start by acknowledging that New Brunswick is situated on unceded, unsurrendered land of the Mi'kmaq, Wolastoqiyik, and Passamaquoddy people. Here we are the land of the Wolastoqiyik, and we're not far from the Wolastoq River. And I myself represent the riding of Memramcook-Tantramar. I'm very proud to have been elected to represent the people there. Lumgug, also known as Fort Folly First Nation, is there. That's Mi'kmaq land. And with municipal reform, now it's divided up into 3 municipalities of Memramcook, of Tantramar, and of Straight Shores. And I'm here today to be their voice and to speak to what is in this budget, what is not in this budget, and to really, I think, express some frustration with how things have not gotten better for many of the people in my riding, but have in fact gotten worse. And I want to just note, I'm going to talk about healthcare, but it's frustrating because when we look at this budget, like, this is a communications document. It's not a line-by-line budget, and in fact, we don't get that. So we're going to go into committee asking questions, searching around, trying to find what exactly is in there. And, you know, the Greens, we have tabled motions in the past, and we've just tabled another one, calling on the government to table the full budgets so that we can do our job, because there's not that much detail in this budget document here. And so I'm going to start with healthcare, because I think that is one of the most pressing needs in my community. We know that in February 2020, this government announced that they were going to be, closing the ERs overnight in 6 rural communities. This was not the first time that our hospital, the Sackville Memorial Hospital, had been under threat. That has also happened under the Gallant government, but it happened again. And we have seen things get worse, frankly, Madam Speaker. So not only do we have compromised ER services at the Sackville Memorial Hospital, there are thousands of people who just in the last 6 or 8 months have actually lost their primary care. We've had 3 family doctors and a nurse practitioner leave their practices, and another family doctor move their practice somewhere else. And so there are thousands of people struggling to find health care, and they are not sure where to go. They've been told to register with HealthLink. That is a bit of a dead end. There's 10,000 people on the waiting list in my area, and they're being pre-registered now. They're not being registered. They can't get health care. There are people with serious medical conditions who are no longer being followed by a primary care practitioner. And it's really scary, Madam Speaker, to think of the health outcomes that are going to be worse for people in my riding and in other places in the province because they can't get the care they need. And it's even more deeply disappointing because this shortage in health human resources was foreseeable. I've said it before. When I first ran for office in 2014, the Nurses Association came and met with me, and I remember them giving me a document. I still have it. And they were talking about how we were in trouble. They had the numbers for how many nurses were of certain ages and how many were going to be retiring in the next number of years, and that we were going to run into big problems with shortages of nurses. If I had that information, that means government definitely should have had that information and should have seen that coming. But for so long, we have seen inaction. We have seen that government after government have let this problem get worse and worse. And now we're in a crisis. We are in a crisis, not just in terms of emergency health care, which is definitely a problem, but now we also have a primary care crisis. And I would love to know what this $20 million to expand collaborative practices in primary health care is for. Where is that going to go? I'd like to know if it's going, at least in part, to the Sackville or the Tantramar primary care clinic. But we also know that that Vitalité, just Vitalité alone, was asking for over $50 million. And we know that a coalition of different healthcare professionals from the New Brunswick Medical Society, the Nurses Union, nurse practitioners, and the Heart and Stroke Foundation, College of Psychologists of New Brunswick, Association of Occupational Therapists, so many different people, they presented an ask for the budget. They said, this is what we need. We need a major investment in healthcare right now, and this is what it looks like. Here's a plan. And Madam Speaker, unfortunately, this government didn't listen. That's not what we see here. Just in this alone, $70 million is what they were saying is needed for team-based care. We see $20 million, and so it's clearly nowhere near where it needs to be. I will acknowledge that there is a bit of money in there for midwifery, and this is something I've been speaking about since I got here, that I'm very passionate about, and I'm glad to see that there's going to be some expansion of midwifery services. Again, I would love more details, but we need to be providing primary care as well as different types of care with different allied health professionals across the province. And so the more we can do that, the better. Thank you. I am concerned about what is here around the 50-bed inpatient residential rehabilitation facility, because I've heard some really concerning things coming from the Premier and from the Minister of Public Safety, talking about what is going to happen in terms of those 50 beds. So let me be clear, we need more beds. There are people who I've tried to help. They say, I want to go into detox, but they don't have room for me. Or they wait for months and months and months to get a bed in rehab. There are people being turned away when they are asking for beds. So we do need more beds. But let's be clear. There should be no coercion. There should be no forced treatment. People should not be held or treated without their consent. And I'm very concerned that that's the path that this government is on when it comes to this. And so while we need the services to be available, we need them to be available across the province. Those that are outside of the public health care system, which I think we should have enough in the public health care system. That's where I think health care should be happening, in the public system. But the ones that are private currently, they should also be regulated. And that is not the case in New Brunswick. And that is very concerning, Madam Speaker, because that means that there's no guarantee of the quality of who's going to be working there, of the treatment that these people will receive. And so that does a disservice to the people who are seeking treatment. And so once again, there's even a report, and I have sent it to some of the ministers who are responsible for this file, from the WHO and from the High Commissioner on Human Rights for the United Nations. And they have written a report and outlined specifically for legislators how to ensure there's not coercion in mental health care, and how to respect human rights. And so I implore this government to read it, to actually look at it, and to abandon the current plan they have. I also want to mention that we don't have a lot of different types of health care that we need in this province, Madam Speaker, whether that be preventative care, whether that be mental health care, whether that be gender-affirming care, whether that be looking more at long-term care and home care. We certainly don't have the funding and the setup that we need in this province, Madam Speaker. And I could talk about how we need more funding for nursing homes. We need the hours of care to be increased. Absolutely, that's something that we've been saying for years, and it's past time that we respect the seniors and the people living in nursing homes and the workers that work there and are doing their best to provide care under difficult circumstances. We need to be paying these care workers. We need pay equity. We need it in the private sector, and let me tell you, Madam Speaker, we also need it specifically in the care sector. Let's start there, because care workers, whether it be home care, long-term care, crisis intervention workers, we need to be paying them what they're worth. That's what pay equity is, paying for the value of that job. And we are not focused on retention as much as we should be. People are leaving those professions for other things. And I've seen amazing home care workers working in retail, and they said, I just couldn't make it work with the wages and the precarious work, and that is just terrible. We need to, not only for the workers, but then for the people who right now maybe are forced to live in a hospital bed. And they're called ALC patients, alternative level of care. And what that means is forced to live in a hospital because there's not support for them outside of the hospital. And it doesn't necessarily need to be in a nursing home or a special care home. It could be through home care and other supports. And I am glad to see the expansion of nursing homes without walls. Port Elgin was one of the pilot sites, and it's really great to see what those folks have been doing to support the people in Straight Shores, in Port Elgin, in my community. And they've had so many people who have been able to stay in their home and get what they need. But it's certainly nowhere near enough, Madam Speaker. Now, I have spent a significant portion of my speech so far just talking about healthcare. I do want to make sure I mention some other things, but before I move on, I want to mention that we need to make sure that we do everything we can to make our healthcare system work, and not all of it is with health human resources. There are other things that can be done, and some of it's more related to on the public health side. We could ensure there's testing and remediation for radon gas across the province. We could ensure that there were paid sick days. We could ensure that caregivers have a refundable tax credit or a financial benefit to support them when they are in a caregiving capacity. And some of these recommendations, such as that one, and ensuring there's at least 26 weeks of leave. Right now, there's only 5 days for people who face a cancer diagnosis, only 5 days guaranteed leave, at least 26 weeks. This is coming from the Canadian Cancer Society, Madam Speaker. And take-home cancer drugs. So many people struggle to decide between paying their rent and paying for groceries and paying for medication, and sometimes ration or decide I can't afford that. And I've heard of stories of people deciding I can't take this medication. It doesn't fit into my budget. And Madam Speaker, that's really scary. No one should be put in that situation of making that decision. And something that I applaud many health professionals, their organizations for including in their reports, including in their recommendations, is a focus on preventative care and on the socioeconomic factors that impact health, on the social determinants of health. And so without a focus on that, we can't truly support people's health in New Brunswick without making sure that people are housed. Housing is a human right, and it's clearly a social determinant of health. We, unfortunately, are seeing more and more people who are dying outside from different situations where they've been unhoused and haven't had the protection of secure shelter. They haven't had the supports they need. We need to have different options in terms of the supports offered, but we need to have a housing first approach. And so that means that we need to meet people where they're at and provide that housing and go from there. And come at it from a rights-based approach. We absolutely need a rent cap. The prices of rent are skyrocketing, and it is unacceptable that the speculation and commodification of housing is forcing people out of their housing. We know that we've lost over 8,600 affordable housing units in New Brunswick. That's just between 2016 and 2021, Madam Speaker. That's a lot of affordable housing gone because the prices went up. And we need to protect what we still have left while adding to it. But if we don't protect what we have left, then it's like pouring water in a bucket with holes. It's not good enough, Madam Speaker. We need to be supporting cooperatives, supporting nonprofits, ensuring that we're building as much housing as we can and making sure that it is affordable. It is an affordable housing crisis. Looking at poverty, looking at this social determinant of health, people's income, we know that social assistance rates are below the poverty line. We know that the extended benefits rates, which are for people with disabilities, are below the poverty line. We know that these amounts don't allow people to live with dignity and to meet their needs. It's legislated poverty to have that amount. So it's clear we need to increase that. We need I think we should take an approach, and the Greens, what we think we need is to actually have a basic income. And this is actually something that's been piloted in PEI with the federal government. That's what we need to do in New Brunswick. Make sure that we're meeting the basic needs of everyone, that people's human rights, that their basic needs are met. How can we do anything less? What we're doing right now is not enough, and it's not okay. What we're doing right now means that like a fifth of New Brunswickers have food insecurity. At least a fifth, depending on where you are, of children are living in poverty, dealing with food insecurity. In some places, it's much higher. I think of places like Campbellton and St. John, where the rates tend to be higher. These are choices that we make, because you can't tell me there's not wealth in this province. Is it distributed in a way that's reasonable or equitable by any stretch of the imagination? Absolutely not. But there is wealth here. Only a handful really benefit from it, but we are making choices with the laws that governments make that allow corporations to do certain things. We have been urging this government to work with the federal government and to take tax havens and offshore money seriously, because there's a whole lot of money that is not being taxed, that is leaving our economy, and people with the least means are being asked to pay for all the public services, and they're not even getting what they need back in return, Madam Speaker. It's hard not to think about the need for climate protection as I look at the weather forecast, Madam Speaker. We're expecting extreme levels of precipitation. 80 to 110 millimeters in some areas of New Brunswick is what they're forecasting, Madam Speaker. I expect flooding to happen in different parts of the province, and this is just one of many threats that we face as New Brunswickers as the climate changes. And one that I've talked about, it's not in the budget, we'll see if it's in the federal budget, but one that impacts my community is certainly the Chignecto Isthmus and the risk of flooding from the Bay of Fundy coming over the dikes that are there. We also have the risk of inland flooding. And this is not unique to my community to be worried about water. This is something that insurance companies are really paying attention to. They're looking at fire and at flooding as really shaping what they're doing and where they are going to stop insuring as well. In my community, I'm really proud that there are people in my community that really take this seriously, and they are understanding that the climate crisis is a public health crisis, actually, Madam Speaker. And so Health Adapt, the Tantramar and Strait Shores Health Adapt, there's a report prepared looking at the healthcare implications of climate change, specifically in my community, prepared by Tracy Wade. And it's very unsettling to read through what we're facing, they looked at the research of what's coming specifically for my community. So, climate hazard, extreme heat. Heat events will happen 25 times more often by 2100 than today. And so some of what comes with that is increases in heat-related illnesses like heat stroke and dehydration, more hospitalizations, higher death rate due to complications created by the extreme heat. And we saw with the heat dome out in British Columbia, just as an example, that people, especially those who are vulnerable, including seniors, they died as a result of this. Extreme weather events, which I think everyone in New Brunswick is unfortunately having to get familiar with, whether it's power outages from wind or ice storms, from hurricanes, heavy rain events and flooding. We're seeing our safety compromised, people being put at risk, let alone their properties also being put at risk, and their businesses, Madam Speaker. What is the plan? I'm very curious, and again, I guess we have to wait till estimates because this document doesn't tell us really what this is going to do. There's a few $1 million in here for protection. I want to know how far that's going to go and where that's going to go, because, Madam Speaker, I can tell you every community in this province is at risk in different ways. Not everyone in terms of something like the Chignecto Isthmus, but certainly at risk. And municipalities are bearing the brunt of this. They're facing this down and looking for help. And we need more help, certainly from the federal government and from the provincial government. Where's the climate risk assessment? Why is that taking so long? It shouldn't have been set to be for 2025. It should have been done by now. We need plans and we need protections in place as soon as possible, Madam Speaker. And things like air quality and water quality are both at risk. Vector-borne diseases such as Lyme disease, we know ticks and certain mosquitoes are expanding northward. Sea level rise and flooding, I think I've touched on that enough, and food security. Food insecurity already exists, but let me tell you, farmers are struggling with these weather events. I know farmers who last year just abandoned crops because they couldn't make it work. It was too wet. And they have also faced drought conditions sometimes, and that's no good either. And so, Mr. Speaker, what are we going to do when we can't feed ourselves? And already we're too focused on exporting food and not on feeding New Brunswickers, and we're more at risk as time passes, because we're not the only ones experiencing these droughts and these floods and things like fires. Places like California, places that we might rely on for food, are also facing these. And so we need to become more resilient and self-reliant, not just when it comes to food, but certainly when it comes to food. You can see a theme here. I'm talking about basic human rights and basic needs: healthcare, housing, eating, food. And so we need to do more. The targets that are set aren't good enough, and agriculture's barely mentioned in here. It's just kind of an afterthought, and it's so fundamental. We need to be listening to what the farmers need. We need to be supporting them, and there's a lot of different things that can happen. Everything from the right to repair idea that we've been talking about, so that farmers can repair their equipment and be able to use different tools with each other. We need to eliminate some corporate greed from this, but also just listening to what they need in terms of growing crops and being able to focus on local markets. We absolutely need to be shifting to more renewable energy, and it's just slow as molasses, Mr. Speaker. We've been moving so slowly in this province for so long, such resistance to installing solar and wind faster. And we just haven't kept up with what we needed to do. It's very terrifying when you actually read the science on the climate crisis, read what's happening. 1.5 to stay alive was something that organizers used to try to draw attention to staying below 1.5 degrees Celsius of warming globally. Last year, we were over 1.5. We're already entering really, really dangerous territory, but we don't seem to be slowing down when it comes to fossil fuels. And to have a government that is still talking about fracking when we're facing this crisis is not just confusing, it's scary, and it shows a lack of being in touch with reality, Mr. Speaker, or shows where the priorities really are. Because I can tell you, if your priority is fracking, it's certainly not people's health, their local communities being strong, and certainly not our climate. If you allow glyphosate to be sprayed and pay for that on our Crown lands, the priorities are also out of whack, Mr. Speaker. We need to stop that practice and stop clear-cutting. We shouldn't be allowing that. That connects back to what I was saying about floods. Clear-cutting contributes to floods, but it also damages habitat, and biodiversity is something that's very at risk, Mr. Speaker. We need to be stepping up on many environmental fronts, not just on climate change, but on biodiversity. And they're all connected. This is all connected, Mr. Speaker. But when we don't understand that what we're spraying over the forest and where we're clear cutting is connected to flooding, then and biodiversity loss, then we're not looking at the science. And I know that there has been a tendency with the Higgs government to not look at the data. I know that. But our responsibility should be to look at the data. I remember being elected and thinking, oh, I'll go to Fredericton and we'll have real policy debates about the bills. And Mr. Speaker, unfortunately, that's often not what I hear in here. I don't hear as many facts and good arguments as I'd like, Mr. Speaker. Speaking of food, I don't know how it is that a society could not ensure that everyone's fed, and especially not ensure that the children in our society are fed. But that's what's happening, Mr. Speaker. And I applaud all of the volunteers and the staff and the teachers in schools who go out of their way to prepare lunches and to run breakfast programs, but they're struggling, Mr. Speaker. They are absolutely struggling, trying to hold it together. And that's another theme. In the healthcare system, the workers are struggling, trying to hold it together. In long-term care. And here we are, our education system. Teachers are burning out. They are not seeing the supports they need for their students or for themselves when it comes to mental health. They are not seeing what they need in terms of infrastructure in their schools. I've heard more than one teacher tell me directly, you know, by the time I make sure everyone's fed, I deal with making sure everyone's clothed, I deal with some behavior issues and someone's trauma, and I might get to put my teacher hat on for the day. Because they are doing so much. We're asking them to do so much. We could do more. This government could do more to make sure that there's a universal school food program for breakfast and lunch in every school. They could do that, and they've decided not to. They could focus on eliminating poverty, on having a basic income, on having livable wages for workers, on having paid sick days so people don't have to choose between getting a paycheck and going to work sick to do that, or being able to stay home, but they don't know what they're going to do when their bills come. Mr. Speaker, these are choices that are being made. A budget document is about priorities and choices, and unfortunately, I don't see that being prioritized. We need to ensure that early childhood educators are being paid fairly, that teachers are being paid fairly, that post-secondary education workers and educators are being paid fairly. All across the board, we see we're underfunding our education system, and we need to look at it like that. It's, you know, pre-K, it's early childhood education, K-12, and post-secondary. And we need to make sure that it's affordable, that people can actually access it, and that we're paying the workers so that there are the daycare spots that people need. I know people who have not gone back to work to be in the workforce. They wanted to, but they couldn't find childcare when their kid turned 1. And that is unacceptable. We need to be paying early childhood educators wages that are fair, and this goes back to retention. We're not retaining the workers we need to be retaining, Mr. Speaker. I know post-secondary education, that I think it's about a third of the workers at that level, the educators are basically in precarious, like, contract work. Things have really changed over time. Government after government has reduced the funding for our public institutions, post-secondary institutions. And what we see is that tuition has gone up. We see that's a barrier for entry for many people. And we see that the workforce has become more precarious, Mr. Speaker. We also see that that some of the issues that students bring are not being addressed as fully as they should be, Mr. Speaker. And I think of some of the priorities of students actually include housing. They're looking for housing. Food insecurity. There are food banks now on campuses. They are looking at university funding increasing, and that's what they're calling for. They, every year that I meet with them, call for more investments and support in terms of mental health and for sexual violence on campuses to be addressed. And I have asked in this House what is happening on that file. And I believe it was taken under advisement, and I never got an answer. Excuse me. But there's supposed to be an action plan, and I would invite the government, if they did develop a plan like they were supposed to please table it with the House, because I would like to know what is happening to ensure that things are getting better in terms of sexual violence on campuses. It is a major issue, and we need to see the details of what's happening with that. When it comes to systemic racism, I would have liked to see funding allocated for a commissioner and for some of the many action steps that we're supposed to be taking. And I know departments here and there have said, when we've asked them, that they're looking at these. But, Mr. Speaker, we need leadership on that. We need an actual response from government, and we need to see funding to go with it. I can't speak about the budget without talking about roads, Mr. Speaker. And you, Mr. Speaker, have had the opportunity to go for a drive in my riding. I believe I drove you on Route 16 and Route 955, and I'm still talking about them, Mr. Speaker, because they have major issues. And all I hear is asset management, and here's a few million, here's a few million. But if government after government have underfunded the roads and our infrastructure and our bridges, we have bridges in poor condition. That's unacceptable, Mr. Speaker. And so we're so far behind. Deferred maintenance, whether that's in schools or with our roads, means that we're so far behind. Asset management is just sort of taking care of the ones that are already okay. We see roads going into disrepair, being unsafe. We see, I do see more money for vegetation management and striping, which I've been talking about for years, so we'll see how that plays out this summer, Mr. Speaker. But this actually isn't just important for safety, even though that's important. It's also important for economic development and for tourism. Because, Mr. Speaker, some of these roads I'm talking about are actually tourist routes, actual tourist routes that are unsafe to drive on. And I've had people from other provinces complain to me about some of these roads. So it's unacceptable, Mr. Speaker. We need to be taking care of the people who live in rural areas. We need to be making sure that they have safe roads to drive on, that are plowed in the winter, that have the mowing and the brush cutting done properly and the striping to make sure they're as safe as can be. Speaking of tourism, Mr. Speaker, I would like to see more focus on tourism, but also on the arts and culture sector. Mr. Speaker, there have been some developments in terms of, exporting our artists, in terms of funding them, but it's nowhere where it needs to be. And the status of the artist is something that we really need to see. And I think that at this point, there's some impatience around this, because tourism and arts and culture is so valuable in our province, and we need to make sure we're treating it as the valuable asset that it is, and be proud of it, but also give it the funding that it needs. And so, Mr. Speaker, I look at this budget, and I hate to say it feels like Groundhog Day, but it certainly does, because every budget, there's not what we need for healthcare, there's not what we need in terms of education, there's not what we need in terms of climate protection and making sure we're dealing with the renewable energy that we need. There's not enough in terms of our food sovereignty and food security. Mr. Speaker, we really need to get our priorities straight, and we really need a government that will invest where it needs to invest, listen to the experts, look at the data, and support the people of New Brunswick, because right now they are struggling and they certainly do not feel the support that they need. And so, Mr. Speaker, I will not be able to support this budget. Thank you.